Welcome everyone, welcome to my channel Medical Lectures and Mnemonic. Today I'm going to talk about a very important topic which is called gastritis. In this video I will discuss the type of gastritis, the acute gastritis, its causes, presentation, treatment, and chronic gastritis and types of chronic gastritis. So the gastritis here you can see derived from the two words. One is the gastro, the other is itis. The gastro means stomach and itis means inflammation. So it is the inflammation of the stomach. Normally, the stomach have an inner lining which is called a mucosa. And here you can see this lining of the stomach is called a mucosa. And the mucosa have a special type of cell which is called a goblet cell, and these goblet cell produce mucus. Here you can see, and these mucus actually cover the mucosa of the stomach and prevent this mucosa from the stomach acid. So when there is any pathology in production of mucus, the mucosa will be exposed to the stomach acid and it will inflame and irritate the stomach, which is called there are two types of gastritis. One is the acute gastritis, the other is chronic gastritis. In acute gastritis, the gastritis is sudden in onset, it is severe and it is lasts for shorter time. In the chronic gastritis, the gastritis is gradual and it is last for longer period of time. So the gastritis, acute gastritis, the causes of acute gastritis, here you can see NSAID. NSAID is actually non-steroidal anti-inflammatory drugs which directly irritate the mucosa of the stomach, and it also inhibit the prostaglandin production, which is the prostaglandin I2, and this is responsible for mucus production. So this NSAID, the NSAID which inhibit the prostaglandin I2 production will decrease the mucus production, which will expose the stomach mucosa to the stomach acid. The other is alcohol, and alcohol which directly irritate the stomach mucosa, and smoking, which the smoking directly relax the lower esophageal sphincter as well as the pyloric sphincter. And when the pyloric sphincter is relaxed, there will be big flow of the bile acid to the stomach, and this bile acid will along with HCl will have a synergistic effect, and it will irritate and inflame the stomach mucosa. The other is brain injury and burn injury. Both of these causes stress, and due to stress the blood flow become decreased to the stomach, and there is decreased oxygenation, therefore make the stomach mucosa more prone to acidic inflammation. And uremia, the uremia also causes gastritis, but the mechanism is unknown how it causes the gastritis. In stress, which I have discussed here in brain injury and burn injury, the stress actually decrease blood flow to the stomach and oxygenation to the stomach, therefore make them prone to be inflamed by the stomach acid. So how the gastritis patient will present? In most of the cases, the acute gastritis is asymptomatic, but the patient may present with epigastric pain, nausea and vomiting, a hematemesis in which the blood is lost and vomiting, melena in which the blood is lost in stool, and fetal blood loss. So when there is hematemesis and melena, it will cause the blood loss and there cause the anemia. So the treatment, now the diagnosis can be done by endoscopy, upper GIT endoscopy, and treatment. Now the treatment by treating the underlying cause. For example, if you have gastritis and you are a chronic user of NSAID, then stop taking NSAID, the gastritis will be relieved. And if you are taking alcohol or you are a chronic smoker, then stop alcohol taking and smoking. Then the other is symptomatic treatment. For example, if you have nausea and vomiting, and you can take the antiemetic drugs like the prochlorpromazine. And if you have anemia due to blood loss, you can take B12 or the iron or the folate. So the symptomatic treatment with antacid, for example, it will directly decrease the acid in the stomach. The antacid include the aluminum hydroxide and the API like esomeprazole, which directly decrease the stomach acid production, and antiemetic, which I have discussed, the chlorpromazine. In the other type of gastritis, there is the chronic gastritis. In chronic gastritis, the gastritis develop gradually, and it lasts for longer period of time. But in chronic gastritis, there is no erosion of the stomach, and the intestinal metaplasia, in which the stomach columnar cell is replaced by this intestinal type of morphologic cell, and there is mucosal atrophy. So these three things. So the chronic gastritis is further divided into two types. One is the type A, the other is type B. And type A, here you can see A mean autoimmune. Here you can memorize like this, A mean autoimmune. So type A is autoimmune, and type A, mostly the body and fundus of the stomach is involved. In this type of chronic gastritis, there is autoantibody produced against the parietal cell in the fundus and body, so there will be no production of acid. It will lead to achlorhydria. And intrinsic factor deficiency. And it is occur about 10% of cases of chronic gastritis. And it will also cause, when the intrinsic factor is not produced, the intrinsic factor is responsible for the vitamin B12 uptake, so there will be vitamin B12 deficiency. And the type A gastritis may be associated with Hashimoto thyroiditis. Here you can see in which autoantibody are produced against the thyroid follicular cell. And Addison disease, which is also an autoimmune disease, and type 1 diabetes, which is also autoimmune disease against the pancreatic Langerhans cells. So the type B is the most common, and it is about 90% of cases of chronic gastritis. And type B, the antrum and pylorus are mostly involved. Here you can see this is the pylorus and this is the antrum, and the antrum and pylorus are mostly involved. And the treatment, the chronic gastritis is also asymptomatic, but it requires no therapy. But the chronic gastritis can also caused by Helicobacter pylori, and you can take the medication which directly eradicate the Helicobacter pylori. So this was all about the gastritis. For more videos, subscribe, like and share. So thanks for watching the video.